Dry AMD is turned out to be a much more difficult problem to conquer than we had thought. Wet AMD, with that dependence on VEGF inhibition, turned out to be relatively straightforward without realizing that at the time. The challenges with dry AMD are multiple. One is that there's, for example, the complement pathway, to use an example. We know that complement is in drusen, but is it really present in geographic atrophy? But to do a clinical trial in just drusen without geographic atrophy would require something like monthly injections for many years, so it becomes prohibitively expensive to develop that. If you look at the geographic atrophy eyes, we can then track them and give injections for monthly for a year and see a change, but it's not clear that it may be too late in the disease state. So we're really now looking at neuroprotection, but the endpoints have not been well established, nor which category of patients we should be looking at. So all of it is turning out to be a challenge, but it looks like we will get there. We're making incremental progress, but the whole process turns out to be quite challenging. Well, the efficacy endpoints for dry AMD are part of the problem that I was just discussing as well. The obvious choice is to do things like looking at area of lesion size, geographic atrophy, or the autofluorescence signal of that. But again, our concern is that some of those therapies, it may be too late. Too much damage has occurred by then. So can we look at microperimetry? Is that a more subtle, so we can look at smaller lesion sizes? So we're searching. There's an ongoing search for better ways to, for example, can we quantitate drusen in a way that we can measure drusen change over time? But sometimes you get increase in drusen, sometimes you get decrease in drusen as the disease evolves. Again, there's an avid hunt going on for coming up with better ways to track the subtle changes associated with dry AMD so that we can have some appropriate endpoints for our clinical trials, but we don't have good answers yet.